Good evening, everyone. Welcome. So are we on? Caitlin, I think we're on.
It looks like it.
All right, everybody, I'm super excited. I'm not alone anymore. Yay! Welcome, everybody, to this month's live question and answer session. And I am joined by the wonderful, the fantastic, the super awesome Dr. Caitlin DeWilde, who helps me with my social media. And she's going to help us answer your questions this tonight on dog mast cell tumors. So hopefully, as everybody is hopping on, we will see who's here, see where everybody's from, and then this is one of the most common skin cancers that we see. Hey, Chandra, welcome. So as people are hopping on, let us know where you're from. We're changing things up just a little. We're going to dive in and answer questions sooner tonight, and hopefully, as you're all getting in, you can tell us where you're from. Angel. Caitlin's usually on. She's usually on behind the scenes. She's the master behind all these things. So she is. You want to tell anyone about you, Dr. DeWilde?
What'd you say?
I said, do you want to tell anyone about you?
That's okay.
No?
For you.
She's just here to help. So what we thought would be really helpful is, hey, Ginger. Ginger, I believe she was the one, Caitlin, that put the question in the event about antihistamines and things like that. So Ginger, I'm really glad you're on, and you're from Boston, which is where I went to undergrad. So welcome, and super excited that you're here, and we will definitely get to your question, and thank you so much for joining. We have someone from Missouri. Caitlin's home state?
Not my home state.
Not your home state, where you reside.
It's where I reside.
Where you reside, where you call home.
Yeah, most days.
She's a road warrior like I am. Can I call you Caitlin?
You can call me Caitlin.
Can I call you Dr. Caitlin?
You can call me whatever you want.
I'll call you the social DVM.
Just Caitlin's fine.
Just Caitlin's fine. So just Caitlin is a speaker like I am, and she's out on the road all the time. And she is also, like I said, always helping me with different ways to get you guys fun and useful information. And I mean fun in the sense that we want it to be memorable and useful information about dogs with mast cell tumors. So as people are hopping on, we have a boxer mom. And as you know, boxers are definitely a dog that are overrepresented in cancer, and we definitely, when it comes to mast cell tumors. So Samantha, welcome. No, not surprised you're here, unfortunately. And so mast cell tumors have been part of her life for 11 years, amongst other cancers. Yeah, so I'm a Labrador lover, and unfortunately, they're a high-risk cancer breed as well. So, I think what's important when you love a certain breed is that you educate yourself, and then if they're at high risk for certain diseases, whether it's cancer or other medical issues, is that you get educated about it, and then you know what the risk factors are, you know what to look for, and hopefully early screening, and we'll talk about early detection as well. So let's dive in. So tonight we are talking about mast cell tumors in dogs, which, as I mentioned, is one of the most common skin cancers that we see. What I mentioned a few minutes earlier, and Caitlin said it would be okay if I moved her up into the corner.
Please, put me in the corner.
So I have to remember which way to lean. So, and see, you're in that corner. Everything's reversed. I'm not very savvy at this. So Caitlin's up in the corner, and Caitlin's going to help to make sure that I don't miss any comments and keep me on track, because as you guys know, I sometimes get a little distracted, especially when there's lots of comments going on. But so typically what I've been doing at these live Q&As is spending about the first 15 minutes trying to go over mast cell tumors. And so what I wanted to do is two different things. So I wanted to give you guys that information easy to find. So we have two videos that I just published, two vlogs, video blogs that are on my YouTube channel. And so one of them is an overview of mast cell tumors, what they are, risk factors and things like that. And we talk about early detection. And then the second video talks about what tests we do and the different treatment options, surgery, radiation, and chemotherapy. So these overviews are on my YouTube channel. So if you want to come back and find them, you don't have to listen to the Q&A, and they're easy to find. And so Caitlin will hopefully be throwing those links into the comment section so you can find them. So the YouTube resources. The other thing that I've done to try to reorganize my YouTube channel is I see a lot of mast cell tumors in practice, and also see a lot of lymphoma and hemangiosarcoma and bone cancer. So I've created separate playlists if there's a patient that I was treating that day or working up with mast cell tumor or any of the other cancers, it's in the playlist, and I've also tried to put it in the title. So I'm trying to make it more user-friendly so you guys can find the information about the different tumors and then see some of the other cases so you can see what, what similarities they may have with your pet and how we're treating them and how well they're doing with chemotherapy. And then also if you're wondering what aspirates are like and things like that. So again, I've just tried to really reorganize YouTube to make it more user-friendly and a really good source of information. With that, before we dive into your questions, my ask for you guys is if you haven't yet subscribed to YouTube channel, if you could do that, if you could comment on that. So I'm really trying to provide useful information for veterinarians, veterinary techs, veterinary professionals, and for pet owners. And the only way that I can get this good information out to you all is for you to like, comment, and share my channel and the video. So if this is information that you like, if you like these videos, please comment, please share, please subscribe to the channel. All right. I think that's it. Should we dive in?
Yep. Let's go.
All right. So what questions do we have about mast cell tumors? So Caitlin, do you want to,
let's start with gingers, because I think that was a really good question.
Okay.
That question was, is there any benefit for a dog with a history of mast cell tumors to staying on an antihistamine and famotidine or cimetidine? Do they offer preventative measures or reduce the risk for future tumors? So that's a good one. So
it's a great question. So let's talk about why we would even think about putting a dog with mast cell tumors on an antihistamine. So mast cell tumors, the cancer cells themselves contain little pockets, little granules, little containers of different substances. And one of the main substances in the mast cell tumor cells is histamine. And you and I all know about, if anybody has allergies. Do you have allergies? Yeah.
I don't, luckily.
You don't, you're lucky. So my son has some allergies, but when you have allergies, and this is allergy season and everything is blooming, it's histamines that causes your nose to run. So histamine is an inflammatory substance. So that's what most of us know histamine has. When mast cell tumors release histamine, they cause local inflammation. And that's why mast cell tumors, when they're growing on your dog's skin, they're notorious for getting red and inflamed and bigger. And then as that histamine gets absorbed into your dog's bloodstream, the mast cell tumor will get small. And what's annoying about that little get bigger, get smaller, is that it often fools pet owners to say, oh, that lump can't be cancer, right? Because a tumor wouldn't get bigger and smaller. So it's not that the cancer got big and smaller, it's that it got inflamed as that histamine got released, and then the histamine got absorbed and it got smaller. So what I find is that waxing and waning behavior sometimes confuses pet owners to not be proactive with the lumps and bumps. So if a dog has a really big mast cell tumor, before surgery, we will recommend that they go on an antihistamine. If a dog has a mast cell tumor that can't be removed, and maybe we're going to use radiation and chemo, we're going to keep them on an antihistamine. The reason we keep them on something like famotidine, which is an antacid, I like omeprazole or cimetidine, is the histamine causes increased stomach acidity, which makes their stomach upset. So often you'll hear dogs with mast cell tumors are on Benadryl and some sort of antacid. Oh, we have a kitty visitor.
Sorry.
No, it's okay. I love it. So usually we will have them on these medications before surgery. And then once the cancer is removed, we take them off these medications. Or I will keep them on these medications if they have mast cell tumor that has spread internally. So for Ginger's question, should the dog stay on it if they've had a history of mast cell tumors? I typically do not use antihistamines and these antacids as a preventative. There's not literature, to my knowledge, that show that that will help prevent mast cell tumors. The other thing that I'd really like to point out is I do think that a confusing question is a lot of times their dog will have one mast cell tumor. It'll be one of the good ones, one of the lower grade ones. It'll be removed with the nice, clean and big margins. And they'll come see me and they'll say, my vet said the dog needs to stay on antihistamines forever, or Pepcid, famotidine forever. So again, I only will keep those dogs on those medications before surgery or if it's too big, it can't be removed, or if the cancer has spread internally. But if your dog just had one mast cell tumor, it's been removed, after surgery, they can come off those medications.
Yep. Good.
All right.
Yeah, my dog has been off of, she had a mast cell removed 3 years
Mabel.
ago. Yeah, 3 years ago. So she is not on anything for that.
Right.
So yeah,
for other issues.
Yeah, so no recurrence there. So that's good. But I did look into that because I wasn't sure, honestly. So okay, let's go to another question.
Wait, I just have to say, I love that we have somebody here from Mexico. We have Kristen. I believe Kristen's from down under, right? Kristen, because she just said that it's good morning. And I believe that Kristen is here from Australia. And she also happens to be a huge Rob Thomas fan. So she's she's just here to listen and learn. So I really love that. So thanks, guys, for joining. And I just love how international the community has become. And I'm super excited that you're all here.
Absolutely.
Yeah.
Okay, so I'm going to pull another one from the event group, which was I get bumps checked on my dogs when they show up. This is from Chris Lewis. But my question is, can a lipoma that continues to get larger over time, even if it's slow, can it eventually become something else like a mast cell tumor?
Okay, so this is a great question, and this is going to give me the opportunity, and so thank you very much, Chris, to talk about my Lumps and Bumps program and one of the things that I'm so passionate about, which is early detection, right? Mm-hmm. So for those of you who follow me and may know about this, bear with me because I think it's worth repeating. So, you know, a couple of years ago, I developed a Lumps and Bumps program called See Something, Do Something, Why Wait, Aspirate. And the whole point of that is that we really want to find these lumps and bumps, these cancers, when they're small. And, you know, so if your dog has a lump or bump, people often say, well, what are the chances that it's going to be malignant? So in general, about 20 to 40% of lumps and bumps in dogs and cats are going to be malignant, a little bit higher in cats. So good news for dogs, right? You know, if you're a gambling woman or a gambling man, you know, statistically speaking, it's more likely to be benign than malignant. But do we want to take that chance? Absolutely not. So I can't look at a mass. You can't look at a mass, Dr. Caitlin.
I definitely can't look at a mass.
No, you can. I mean, and I've been fooled by, you know, I'll have a dog come in and there's one that I'm like, ooh, I think that one's going to be a mast cell tumor. And I'm like, oh, I think that one's going to be a lipoma. Yeah. And I'll aspirate them and they'll be the opposite. So you never know. And you can have 4 that look exactly the same. And about 2 years ago, I had a boxer named Amy came to me for a different tumor. She had 4 masses that were all about 3 centimeters. They'd been there for years. They were all about this big. And I asked mom if I could aspirate them. They all looked and felt the same. 3, we got our calipers, 3 of them were mast cell tumors, and 1 of them was a lipoma. So again, the take-home message for this, guys, is that you can't look at a mass, you can't field a mass. Doesn't matter if 10 of your dog's previous masses have been lipomas. You need, each individual mass needs to be aspirated, and those cells need to be looked at under the microscope and make sure, you know, that we know what it is. So the reason that it's so important to see something, do something. So the guidelines are, if the mass is the size of a pea and been there a month, to go to your vet and get an aspirate. And so the reason that we want it to be the size of a pea, which is 1 centimeter, which is really, really small, super, super small, which is the size of a Skittle, the size of an M&M, is because for mast cell tumors and malignant tumors, we often need to get a really big normal rim of tissue around the cancer. So if your dog has a mast cell tumor that's 1 centimeter, they should come home with an incision that is 3 centimeters on each side, so 7 centimeters. So guys, if we let our dog get, you know, their mast cell tumors get to be 5 centimeters, they need to come home with incisions that are 11 centimeters. Put that down over the leg, put that on a Chihuahua, put that on a Boston Terrier or a small dog. It's going to be really hard. And so those are the dogs that you get back the biopsy report and your vet calls you and says they didn't get clean margins, or your dog is at risk for the tumor to grow back. So again, and I talk about this in the YouTube video, very specifically, there's 2 issues after surgery. Will the cancer come back? And what is the risk of the cancer spreading? So again, I know, Chris, I'm going to come back to your question, but I think it's really important why, people say, well, why a centimeter? Why so small? So it's really important that you find these lumps and bumps when they're very, very small. Go to your vet and get an aspirate. And so some of the things that we have available for you for free on my website, drsuecancervet.com, and I have to say, it's Caitlin that really helped me make everything beautiful, is we have skin maps. And so this is a way for you to be able to keep track of your dog's lumps and bumps. And so if you find something and you're not sure when you're going to the vet, maybe it's going to be 3 weeks, you can mark it down. Is it on the, the right, the left, the top, the bottom? You can measure it, and then you can bring this to your vet and say, I found this, and you know exactly where it is when you go to the vet. And if things have been aspirated, you can keep track of it, and we keep track of their scars and everything like that. So all of this is available on my website in the pet owner resource section, drsuecancervet.com. So again, it's really important that you guys are proactive. We can throw the link in there as well, but it's really important that you're proactive, because guys, you're with your pets way more than we, the veterinarian, are, and you're petting them, you're feeling them. So again, if you find something, mark it. And we even sell those calipers online as well. And at the end, we'll throw the code up where, a discount code, but it's important that you're measuring them, keeping track of them. And then if, again, anything's the size of a pea, or an M&M or a Skittle and been there a month, go to your vet and get an aspirate. Well, maybe they don't like these. I like these.
I don't know why at all. Yeah, those maps are super helpful, because I'm just a general practitioner, and people will bring their pets to me and they will say, oh, my husband felt a lump, and then we spend like 20 minutes trying to find it, and even like I can't find it and they can't find it, and then they get home and they're like, here it is, and I'm just like, oh, bring it back in. But it's hard sometimes, especially if you have a lumpy, bumpy older dog, or a big fluffy dog, or a dog that really doesn't like being touched at the vet.
Yeah.
to keep track of all those. So I think those are super helpful. I'm gonna segue from Chris's question, because we have 2 kind of related questions.
I didn't answer his question yet.
I know, but we have an aspirate question. So
okay, we'll make sure that I come back to his question.
I'm on it, Chris.
Okay.
I will lay you down.
Okay.
So it's like kind of 2 questions actually.
Okay.
What do you do if it's less than a centimeter? Dun, dun, dun.
And okay, so it's never wrong, especially if it's been there a month. So the reason that we did a month is there will be things like scar tissue. If your dog is out playing in the yard and they're roughhousing and they run into a branch or something like that, they may have a little bit of a scar tissue or a little bit of a local inflammatory response to a little bit of an injury that's going to go away over the next couple of weeks. So that's why we picked a month, because if it's getting smaller and resolves over its own, probably not a cancer. You don't have to worry about it. But say you have a mass, and I do have some owners that are very proactive because their pets have had either soft tissue sarcomas or mast cell tumors like we're talking about. And sometimes if it's less than a centimeter, like maybe half of a centimeter, 5 millimeters, it can be really hard to aspirate it. So usually the easiest thing to do is a punch biopsy, the nice thing about that is your vet can do it with local sedation. So a little lidocaine block under the skin and punch it out. And the nice thing about that is if it does turn out to be a mast cell tumor or some other malignant cancer, it's just been a little punch biopsy. You can still go back and do that nice big wide surgery. You haven't disturbed the tissue so much that it's going to make it very hard to be able to go back and do the surgery. So again, if it's less than a centimeter and you want to find out what it is, sometimes we can still aspirate it. But the other thing to ask your vet or to talk to your vet, or in the guidelines or the protocol guidelines for the program, See Something, Do Something, is to just have your vet do a simple punch biopsy with local. So they don't need general anesthesia and things like that. The only time that they might need a little bit of sedation is if they have that lump or bump over the face, because you can imagine lots of dogs, even with a local, if it's near the eye, they don't want you coming in and stuff like that. So sometimes if we've had to do a punch biopsy on the muzzle, we will give them a little bit of a sedative just to kind of take the edge off, because you can imagine often dogs don't want you coming at their muzzle. It's very sensitive, especially near their whiskers.
It's totally fair. Totally fair.
Totally fair.
And sort of related to that is, are you going to spread the cancer if you aspirate it?
Such a good question. I feel like it's such an urban legend. It's a common question that I get asked all the time. No, the answer is no. You will not spread a cancer by doing an aspirate or removing it or anything like that. There are some internal cancers that when you aspirate, like bladder cancer, for example, is one that there's a little bit of controversy that you could, as you drag that needle through it. But the long and the short for these skin lumps and bumps, the other thing, guys, think about it, is where you're aspirating it, that's going to be removed. So if it is malignant, you're removing that anyway, but it doesn't cause it to spread internally. It doesn't cause it. The only thing that mast cell tumors can do when you aspirate them, especially the more aggressive, higher grade ones, and we don't find out the grade until we get back our biopsy. And again, I go through that in the intro video, the part 1 of the mast cell tumors. But one of the things is you can cause that histamine release. So sometimes if I'm aspirating something and I don't know if it's a mast cell tumor and it starts to swell up, I'll give that dog some injectable Benadryl. If I suspect it's a mast cell tumor and the classic one is a red, hot, really inflamed, hairless mass, but again, they can look like lipomas, but the ones that I'm suspecting are going to be a mast cell tumor, I will pre-treat that dog with some Benadryl as that antihistamine. But again, that's not spreading the tumor, that's just causing the histamine to be released locally around the tumor.
Right. Sweet. That was great. Okay, we're going back to Chris now.
Yay! We didn't forget about you, Chris. So his question, if I remember, was
can lipoma that continues to get larger over time become something else like a mast cell tumor?
Yeah. So in some of in general, lipomas don't morph into things like mast cell tumors. There are some low-grade soft tissue sarcomas and low-grade mast cell tumors that when they recur, come back as more aggressive high-grade ones. But lipomas don't usually morph into mast cell tumors or things like that. But this is where I do think we need to be cautious when your vet aspirates something and it comes back as a lipoma. Two things. Some lipomas need to be removed, right? If that lipoma is getting big and it's in an area where it's hindering your dog's mobility, maybe it's in the armpit, right? And it's becoming this thing that's rubbing, or it's getting ulcerated, or they're sitting down on it, or they're actually starting to lick at it. Sometimes even benign lipomas should be removed and before they get big, right? Because once they get big, they can become as challenging as a malignancy. So even if something is benign, sometimes it's important to get it removed. So if that lipoma is getting bigger, the other thing is if your vet aspirates something, they say, oh, good news, it's a lipoma. And it went from being, so you've documented, you have your little chart, and they said, you know what? On your dog's left thigh, there was a 3-centimeter lipoma, and you've marked it. And then 6 weeks later, it's doubled in size, and because you've measured it, that's not normal for a lipoma. You need to go back to the vet and you say, you know what, we need to get a biopsy of it, because cytology is not perfect. And so if something is continuing to grow, you might need to go back to your vet and say, you know what, this is getting bigger. I feel like this might not be the right, diagnosis. So cytology, why would I do cytology? What I love about cytology is it's relatively inexpensive. It doesn't require sedation. It doesn't require, it's really inexpensive, and we get the results back very quickly. And for most lumps and bumps, it's quite accurate. But nothing is perfect in medicine, in dogs, cats, and people. So if something's not fitting with how it's, acting in your dog, use your parents' intuition, as I say, and then you might want to go back. So again, if you have a lipoma that's doubling in size in, a couple of weeks or months, go back to your vet and maybe say, you know what, we need to get a piece of tissue. Maybe that aspirate wasn't correct. So that's why I just never blow anything off. Say, it was benign. I'm not going to worry about it.
Right. Good advice. Sorry about the delay, Chris. So I think that was a good
answer. We got there.
We did get there. Okay, I've got another good question from Deb Donahue. What options are available for mast cell tumors that are not surgically resectable?
Okay, so that's a great question. And so it will depend on where it is in the dog and what else is going on with the dog, but just sort of like globally as big issues. So if I have a dog that the mast cell tumor is too big for surgery, but I still think if we shrink it a little, I might be able to get it to surgery. Sometimes I'll give a couple of doses of chemotherapy in attempt to try to shrink the tumor. Usually I tell the owners about 2 to 4 weekly doses of a drug called vinblastine with steroids is usually what I'll do. Try to shrink the tumor and then get it to surgery. Sometimes you just have a huge tumor that you just suspect this is, it's too big for even to try to shrink it and get it off. Another good option would be radiation therapy. The hard part about radiation is you have to be near a radiation facility, and so it depends on the part of the country. I'm in the metro New York area. It's not that hard to find a veterinary radiation facility, whether you go to New York City or, north of New York City. We have a good number available, probably within 30 to 60 minutes from somebody driving. How far is radiation from you, Caitlin?
It's within 30 minutes for me. So
yeah.
But where I'm from, it's a solid 3 hours.
Right. So there are parts of the country where radiation is not going to be an option. And there's 2 types of radiation. The radiation that we're usually doing for non-surgical mast cell tumors is often weekly radiations called palliative radiation, often combined with steroids. And sometimes we can combine that with chemo. And then say radiation's not an option. Sometimes we can just say, well, we'll try chemo and see if we can shrink it with steroids. That would be an option. And then last but not least would just be steroids alone. You can also do injectable steroids, which is sort of a plan F option. So not my first option, but you're not going to want to do that with injectable steroids because of the risk of ulcers. So again, for a non-surgical one, I might try to do some chemo before surgery. I might do some radiation with steroids. I might do chemotherapy with steroids, and then the chemotherapy protocol, and again, I go through the different drugs that we often use, but there's Palladia, vinblastine, and lomustine are really the major drugs that we often use for mast cell tumors, and prednisone in combination with those as well. And for a non-surgical mast cell tumor going back, that dog is going to be on an antihistamine and the stomach protectant, right? For sure, because that dog is at risk of, extra histamines causing stomach irritation. So that dog for sure is, going to be on the protectants that we talked about.
Right. Perfect. And you talked about, you have another video that's really great and kind of ties into another question we have from Emily, which is a little bit specific to a case, but it's about a dog not eating after treatment. Mm-hmm. And so you have a couple of really good videos on YouTube about those kind of things and kind of tying in with why we're doing the stomach protectants and things like that. Sometimes appetite stimulants, those kind of things.
Did she happen to mention, just curious, what drug the dog got?
Tenovia.
Mm-hmm. Okay, so that would be for lymphoma. So we'll talk about inaptitudes associated with chemotherapy, but that's okay, but she's not going to question. So Tenovia is conditionally licensed, so it is against the drug label to use it for anything other than dogs with lymphoma. So I hope that is for a dog with lymphoma. And so anytime that a dog's not eating after chemo, the question was it eating before it got the chemotherapy? Because sometimes it's the cancer itself. So lymphoma, can cause a dog not to be eating sometimes before they get the chemo. And then mast cell tumors, sometimes a dog, if their stomach is irritated from all the histamines, may not be eating. But yeah, we do have a lot of good videos. So let's say the dog was eating before it got any chemo, then you give chemo and they're not eating. So in my practice, any dog that goes home after chemotherapy will go home with the goodie bag, the doggy bag, right? And they're going to have a nausea medication. So I want them to go home with oral Cerenia. And so I do have a video, the top 5 medications that you should have on hand at home if your pet is going through chemo. So it's going to be a nausea medication. It's going to be a diarrhea medication. It's going to be a probiotic. And now there's also a new great medication called Entice, which is an appetite stimulant. It's different than Cerenia, which is a nausea medication, and we'll often use the two together. And then then there are some other diarrhea medications that I like as well. So clay and other things. And then just in case there are any cat owners in there, maybe someone has a cat that's going through chemo, or cats with kidney disease, there's a great new cat appetite stimulant that's topical that goes on the ear that I've been using a lot in practice called Mirataz. So Entice for dogs to stimulate the appetite, and Mirataz, which is mirtazapine topical, so you don't have to pill your cat, which is
so great.
because I could not pill Jeter. He was a pill to pill. So I think if your dog is not eating after chemotherapy, you know, whether it's due to the cancer or due to the chemo, you want to make sure that you have those medications on hand at home, and you want to talk to your oncologist or your veterinarian, and you want to make sure that they know that your pet didn't eat. Sometimes simply just starting those medications the next time around, they're going to eat fine. Sometimes we will need to adjust the dose for the next time around. So what's really important is that you don't just say, you know what, this must be normal for a dog going through chemo, and not mention it to your oncologist or your veterinarian, because they should be eating after. And if not, they either need those medications, or the oncologist, like myself, needs to adjust the chemo. So, you know, 80% of dogs and cats tolerate chemo really, really well. And so if they're having severe side effects and they're not eating, and you're home cooking and you're sitting on the floor and it's taking you 45 minutes to feed them chicken, we need to be adjusting something that we're doing. So make sure you tell the nurse or your oncologist about those side effects, so we can do things, because we have really good medications right now. And Serenia is a once a day medication. Back when I was a resident, the nausea medication was 3 times a day. So every 8 hours we were telling owners to medicate. Yeah. So definitely some great medications on there.
Yeah. Perfect. So we have 2 questions that I can answer, and I'm excited about that.
I can answer. I can drink some water.
Yeah, you can have a drink. So Allison asked if we could, Samantha asked if you could share the skin maps on websites and social media for clients and friends to find. And absolutely, you totally can.
Yeah,
we can probably even share the pretty version of it on social media tomorrow. So look for that. I also wanted to address Allison's question and a couple questions that are kind of veterinary case specific. And I think what might be good to point out now is that you have the veterinary professional Facebook group that veterinarians and technicians can join and ask their questions there that are specific case ones. So it might be a helpful resource there for some of these more specific ones.
Yeah.
So I'll give it back to you, because I was so excited that I could answer one. But how about one from Shelley, which is, are there certain foods to avoid after diagnosis?
Diet, I always take a deep sigh. Diet is very controversial in general for cancer patients. So the concern that people always have is, we know that cancer cells, this is what we know, rely on sugar as their energy source. So the idea is, should we put our dogs, I always say, on an Atkins-like diet, something that's high in fats, high in proteins, and low in carbs. And this is not just for dogs with mast cell tumors, but for dogs sort of across the board. So you'll see these cancer diets that, again, are high in fats, good fish oils and things like that, high in proteins especially, and low in carbs. The question is, will it statistically make a difference? My feeling is that if you want to do one of the cancer diets, make sure it's one that's been run by a nutritionist. Just don't go and start home cooking for your dog a high fat, high protein diet, because they need a lot of minerals. There's a lot of good things that comes from these well-balanced diet. There are supplements if you're going to home cook, for my clients that want to home cook, in the book that I co-wrote, the Dog Cancer Survival Guide, there is a home cooked diet in there that you can do. I had one of my colleagues who's a board certified nutritionist run the diet through his program. It's a good diet as long as you're supplementing with a multivitamin, and that's covered in the book. There are other dog cancer diets that a client just brought in one today I'd never seen before. And so I said, we need to run this by a nutritionist, or you need to do one that we know, or you need to consult with a nutritionist. The other thing that I think is probably more important is that you're feeding your dog a good diet. And so a fresh diet is great. A well-balanced diet is great. A diet that has fruits and vegetables, just as in people, the least processed food. And again, I don't have science to show this, but we know that in people, that a diet that is low in fruits and vegetables is a risk factor for cancer. So of course, there are certain vegetables and fruits that we want to avoid in dogs. So we want to avoid grapes and raisins and onions. Those are some of the chocolate, but we're not putting chocolate in our dog's food. But, so again, there are studies that show if you give your dogs more vegetables, it can decrease their risk of bladder cancer. So I give my dogs all the fruits and vegetables that I can. Carrots, Matilda will not eat cucumbers. She'll eat romaine lettuce, but, so I just am supplementing them with extra fruits and vegetables, and then I feed them, and there's a lot of great diets, these fresh diets or these frozen fresh diets are all the rave, but they're really expensive. What I can't tell you is that they're going to statistically make a difference, and it can get really expensive. So I think, there are certain things that you can do. You can add fish oils to your pet's diet. You can add some fruits and vegetables, avoiding the ones that are toxic for your pets. You can home cook for your diet. Just make sure it's a diet that is balanced. Is there a trigger food for mast cell tumors? I don't think so. But again, I think it depends on, do you want to do a home cooked diet, or do you want to do a good diet and supplement with some of these other things?
Great info. Okay, so I've got one more question here from Christy, and you kind of covered it a little bit, but I think it's worth revisiting. So she's had a bull mastiff that had a mast cell tumor that can't be removed due to the location. It's a low grade 2, but it's getting a little bit bigger. What are the options, again, just quickly to reduce any size concerns?
Okay, so love bull mastiffs. They're just really, really good dogs. So 8-year-old bull mastiff, so that's great. And
already beating the scales there.
Also, Bruno, who we talk about in our ebook, he's a little bonus story. So he's a bull mastiff that I treated, and he had about a mast cell tumor at least a year, and he lived to be 14 and a half. And it was actually osteosarcoma that he lived 2 years and 4 months after. He also had a soft tissue sarcoma. We always called that he was the poster child for see something, do something, because literally every year, at least, he had a low grade 2 mast cell tumor that was removed. But again, it's a good reminder that sometimes dogs will have a bunch of low grade ones, and the next one can be a high grade. And if, again, I want to use this time to answer questions, but if you're like, what is this grade all about? The high grade, the low grade, that is all covered in the YouTube videos that are there. So again, I did try to break that all down for you there. So she has a low grade mast cell tumor that is increased size, or anything you can do to reduce the size. So chemo would potentially be a good option with steroids. Radiation, again, depending on your area. Ideally, what I would love to do is shrink the tumor and then remove the rest of it surgically. That's usually the best. I have had some where the radiation oncologist, we've been able to shrink it just with or get it down, completely gone with just radiation. But again, usually I'm using radiation or chemotherapy to shrink those, and then we're going to clean up the rest with surgery. Ideally, surgery, like if you have to think of one treatment for a dog with mast cell tumor, if you have thinking surgery, radiation, and chemotherapy, surgery is the treatment of choice. And for most dogs, with low and intermediate, these grade 1, grade 2 mast cell tumors, the low grade on the other system, that you find when they're small, even on the leg, if you remove them with clean and wide margins, that's usually curative for a lot of these dogs. And that really goes back to feel your dogs once a month, find these lumps and bumps, because it eliminates, and I don't want to make anyone feel bad, but the other thing to remember, guys, is that once a dog has a mast cell tumor, 10 to 20% will have another mast cell tumor. It could be in 3 months, it may be in a year like Bruno, it may be in 4 years. So it's really important that and each one can be low and one can be high. So it's really important that you're feeling these dogs and that you're, finding these lumps and bumps early, because again, if we can remove them when they're small, we're done with them. And then, you know, and a lot of the headaches that you guys are all dealing with would be gone. And I'm not trying to minimize what you're going through, but again, I think early prevention, and this goes for soft tissue sarcomas, one of the other common skin cancers that we see. If we can find them when they're small for these low and intermediate grade, we can cure dogs, and then they don't need more radiation, they don't need chemotherapy, and it just would make everybody's lives a lot easier, save you all a lot of heartache and a lot of money.
Mm-hmm. Absolutely. Okay, I think we've got one good one to end on, which is, can you just briefly go over life expectancy?
So
I'm sure, so easy.
Right? Not an easy one to end on.
It's not. But
so, no, I mean, it's a great question. So, and it's a common question that I get. So, and I talk about these in the videos, but I want to repeat this. Mast cell tumors are treatable tumors. Mast cell tumors are treatable tumors, whether they're the less aggressive one or even the high grade 3 mast cell tumors that have spread internally. These are definitely treatable tumors. They just require different intensities of treatment. So a dog that comes in with a small, low grade, grade 1, grade 2 mast cell tumor that's completely removed is essentially cured. And I expect that dog's life expectancy to be great, you know, and usually we'll have other issues like Bruno, you know, that 6 years later would develop bone cancer, you know, even though he had a mast cell tumor a year. That doesn't mean those dogs don't come in for routine monitoring. I usually see them back every 3 months for the first year, and then every 4 to 6 months indefinitely, because they still can metastasize or spread, but it's usually low enough risk that we're not going to recommend chemotherapy. But I still expect those dogs to have an excellent long-term prognosis. If you have a dog that had an incompletely removed mast cell tumor, which is a great question, we can do full course radiation, and those dogs also have wonderful long-term prognosis. They just required radiation because we couldn't get the big surgical margins. For the dog with the high-grade mast cell tumor, some of that will really depend, but say it was a dog that you could still remove it and still had spread, you know, I can still get those dogs out often a year with chemotherapy. And I know a lot of people say a year doesn't seem like a long time, but a year for a dog with metastatic cancer is not, you know, which is like a human, you know, going to the oncologist and being told 5 to 7 years. So I'm back. Must be time to wrap up. Can you hear me?
I was like, oh no.
I'm done. I'm out. Peace out. That's clear sign that the video must have. Caitlin, can you answer the rest of the questions?
I got nothing, guys. I got nothing.
But, you know, the point is, you know, even a dog with a high-grade mast cell tumor that has spread can be treated and do really well. And again, going back to 80% of dogs have minimal side effects going through chemotherapy. It's not going to be as good a prognosis for the dog that we found it small and had surgery. But again, I still think it's really important that you know, especially for a dog with a high grade mast cell tumor or non-surgical mast cell tumor, these are the ones where you want to get to see an oncologist. So one link that we should definitely put in there is vetspecialist.com. That's a great place to help you find a board certified cancer specialist near you. You know, put in your zip code and find one, because some of these mast cell tumors can be really complicated. Some of them can be really straightforward. So, you know, I always say one size does not fit all. I really think it's helpful to, you know, if you're having one of the complicated, I think all mast cell tumors should see a cancer specialist, but I'm completely biased because I am a cancer specialist. And I realize the reason I do these things and the reason I go out and lecture all over the country is it's not practical for every dog to see a cancer specialist, because there's only 400 of us in the US and Canada. So, you know, I'm always teaching general practitioners ways to manage these cases better. Also believe in supplements and things like that. So another good video on YouTube is different supplements that I use, and you can talk to your veterinarian about that. And then also just a little bit of a disclaimer, guys, this never replaces, you know, seeing your veterinarian. We don't want to be Dr. Google. We just want to give you a little bit of information, a little bit of hope, and hopefully provide you some information and inspiration to be able to talk to your veterinarian, maybe go see a specialist, and as we say, kick cancer's butt, right?
That's right. Absolutely.
All right. If you guys missed this, it will be on YouTube probably tomorrow, the next day. If you could also do me a favor, if you have a friend whose dog is going through mast cell tumor and you think this information will help them, if you could tag them in the comments on Facebook, that would be great. And then same thing, if you, on YouTube, if you think this video is helpful, share it, like it, comment, all of that really, really helps get us noticed, get us seen, and then gets more people, to get this good information. And I hope that you found it good. I hope that you found it helpful. Caitlin, I really liked having you. Uh-oh, that means I might make you come back next time.
Oh, no. We'll see.
What are we doing next month? Have we decided?
I'm not sure we've decided.
All right.
I've forgotten. You put me on the spot.
Yeah. Bone cancer? Mangio?
It might be bone cancer.
Okay. That's a good one. I mean, a good one because there's lots of questions.
Good.
Is there somewhere to send our reports and scans to get advice? No, that's a great question. So unfortunately, I don't do individual consultations over the phone. I just, it's the best if you are in the Metro New York area and you want to come see me. I do in-person consultations. But the other thing would be to talk to your veterinarian, and to talk to a specialist in your area. So at some point, I'd love to be helping more veterinarians with online consultations. It's a little idea that I have, but nothing that's set up yet. So, but at this point, talk to your veterinarian, talk to a specialist in your area. Mm-hmm. Oh, wait. Before we go. So if anybody is super gung-ho and wants to get your own set of calipers, and so Caitlin, of course, has all my stuff, but so we have the digital calipers, and these are really good, in my opinion, for veterinarians. For pet owners, I don't know that you need the digital calipers. Caitlin's got them out right now. Caitlin.
They're good for me. I like it because I can, in practice, I get like very, very specific, for my records, for my medical records, I can get it.
Yeah.
Super, super specific.
But we also have plastic calipers, and so these are lighter, and these are pretty good. I have to say, I like these a lot. I have these like in every purse, and I've been known to measure things at meals. Wine glasses, olives, pieces of cheese, and then we also have caliper pens. And the fun things about this can go in your pocket as well. And I think your son walked off with your caliper pen.
He did. Well, now my cat's behind me, so I was trying to measure him for you, but he's not happy about it.
All right, guys, thank you so much for joining us. I really hope that you found this helpful. Dr. Caitlin, you rock. So much fun to have you.
It was fun. All right, everybody.
All right. See you guys soon. Take care. Bye.